Ulcerative colitis may be a comparatively common semi-permanent condition that causes inflammation within the colon. It's a kind of inflammatory gut illness (IBD) that's the same as Crohn's illness. The colon removes nutrients from undigested food and eliminates waste merchandise through the body part and porta as feces. In severe cases, ulcers kind on the liner of the colon. These ulcers could bleed, that produces pus and mucus secretion. Various medication choices measure out there, and doctors will tailor treatment to fulfill individual wants. In this article, we have a tendency to cull the symptoms, risk factors, and doable causes of inflammatory bowel disease, further as some treatment choices. Symptoms: abdominal pain may be a common symptom of inflammatory bowel disease. The first symptom of inflammatory bowel disease is typically looseness of the bowels. Stools become increasingly looser, and a few individuals could experience abdominal pain with cramps and a severe urge to travel to the toilet. Diarrhea could begin slowly or suddenly. Symptoms rely upon the extent and unfold of inflammation. The most common symptoms of inflammatory bowel disease include abdominal pain, bloody looseness of the bowels with mucus secretion. Some individuals can also experience fatigue or weariness, weight loss, loss of craving, anemia, elevated temperature, dehydration, a constant urge to pass stools. Symptoms measure usually worse early within the morning. Symptoms could also be gentle or absent for months or years at a time. However, they're going to typically come while not treatment and vary looking on the affected a part of the colon. Type: symptoms could vary looking on the world of inflammation. The sections below discuss the assorted styles of inflammatory bowel disease, several of that have an effect on totally different elements of the colon. Ulcerative rubor: this type affects solely the top of the colon, or the body part. Symptoms tend to include rectal hurt, which can be the sole symptom, rectal pain and inability to pass stools despite frequent urges. Ulcerative rubor is typically the mildest kind of inflammatory bowel disease. Proctosigmoiditis: this involves the body part and therefore the sigmoid flexure, that is, the lower finish of the colon. Symptoms include bloody looseness of the bowels, abdominal cramps, abdominal pain, a constant urge to pass stool. Left-sided rubor: this affects the body part and therefore the left aspect of the sigmoid and colon. Symptoms typically include bloody looseness of the bowels, abdominal cramping on the left aspect, weight loss. Pancolitis: this affects the complete colon. Symptoms include occasionally severe, bloody looseness of the bowels, abdominal pain and cramps, fatigue, considerable weight loss. Fulminant rubor: this is a rare, probably life-threatening kind of rubor that affects the complete colon. Symptoms tend to incorporate severe pain and looseness of the bowels, which may result in dehydration and shock. Fulminant rubor will give a risk of colon rupture and cytotoxic colon, that causes the colon to become severely distended. Diet: according to the National Institute of Polygenic Disorder and Organic Process and Urinary Organ Diseases (NIDDK), some dietary measures could facilitate relieve symptoms, including eating smaller, additional regular meals, like 5 or 6 tiny meals per day, drinking many fluids, particularly water, to forestall dehydration, avoiding alkaloid and alcohol, which may each increase looseness of the bowels, avoiding sodas, which may increase gas, keeping a food diary to spot that foods create symptoms worse. A doctor could counsel quickly following a selected diet looking on symptoms, such as a low-fiber diet, a lactose-free diet, a low-fat diet, a low-salt diet. It may facilitate to require supplements or eliminate specific foods from the diet. However, someone ought to discuss any complementary or different measures with a doctor before attempting them. Causes: the exact causes of inflammatory bowel disease measure unclear. However, they will involve the following. Genetics research suggests that individuals with inflammatory bowel disease measure additional possible to possess sure genetic options. The precise genetic feature that someone has could have an effect on the age at that the illness seems. Environmental: the following environmental factors would possibly have an effect on the onset of lesion colitis. Diet, air pollution, cigarette smoke, immune system. The body would possibly answer an infective agent or microorganism infection during an approach that causes the inflammation related to inflammatory bowel disease. Once the infection resolves, the system continues to reply, that results in current inflammation. Another theory suggests that inflammatory bowel disease could also be associate degree reaction condition. A fault within the system could cause it to fight non-existent infections, resulting in inflammation within the colon. Risk factors. Some proverbial risk factors for inflammatory bowel disease include age. Inflammatory bowel disease will have an effect on individuals at any age, however is additional common at 15 to 30 years older. Ethnicity. White race and people of Ashkenazi individual descent have a better risk of developing the condition. Genetics. Though recent studies have known specific genes which will play a task in inflammatory bowel disease, the link is unclear thanks to the role of environmental factors. Medical news nowadays. Reports stay within the grasp. Get our free daily report. Expect in-depth, science-backed top lines of our greatest stories on a daily basis. Faucet in and keep your curiosity glad.